I'm Dr. Andres Fonseca. I'm a consultant psychiatrist by background, and I'm one of the founders at Thrive Mental Wellbeing. I'm also the CEO at Thrive. It says here in the first slide, importance of sleep on your mental health. Okay. It's a little bit of a misnomer because I'm not just going to talk about mental health. I'm going to talk about health in general and how sleep affects health in general. Because I think obviously it has effects on mental health, as we're going to see, but it affects all health. And also, I suppose the message that I'm trying to give you as well is that mental health is health and health is mental health, and they both influence one another. This artificial divide that we have in our heads, which is very intuitive to us as people, that there's this thing called mental and this thing called physical, is not true in reality. They're both mixed and affect one another, and actually they are the same thing. We just have two names for it. And we will see. I mean, I think I will be able to illustrate that for you with this specific example as well. So this is kind of an overview of what the session is going to look like. I would try to persuade you to believe me when I say that sleep is very important for your health in general. I know that people do appreciate sleep, but in some cases, in some circumstances, people feel that it's justified to, for example, reduce your sleep because you want to be more productive or things like that. And there are some popular ideas, and it's been popularized by some leaders that have spoken about this in the past, saying that they don't need a lot of sleep. Famously, Churchill, for example, Margaret Thatcher, Ronald Reagan, famously claimed to sleep a short time, and that's something that sometimes is seen as if you deprive yourself of sleep to increase your productivity is a good thing, and I'm going to try to persuade you that is not, and it's never a good idea. Even if you want to be more productive, you should sleep enough. So that's quite important. Obviously, we're going to focus on how to get a good night's sleep. I think a lot of you are here for that, so we're definitely going through that. We're going to go through breaking down what the science says that provides the best sleep. And there's a couple of misconceptions there that people tend to have. For example, we'll talk a little bit about sleep remedies and what their role may or may not be, and try to understand them a little bit better. I'll do that at the end as well. When I tell you all of the things that actually do work, I will tell you something about that, and maybe there's an appropriate use for them, maybe not. Spoiler alert: in most cases, not. But I'll explain why. And then, obviously, how and when to seek help. This is a problem that we should take more seriously than perhaps we do. Hopefully, the first bit of the seminar will give you an idea of why it is so important. And obviously, we'll have an opportunity to ask questions at the end. So if you want to pop those questions in the Q&A as we go along, that's absolutely fine. I'll be able to address them at the end. If you put them in the chat, they might get lost. So it's just so you know. All right. So I've got three areas to talk about in terms of why sleep is so important. The first thing that I would say is that if we could just think about this, if we could do away with sleep, we would have been able to do away with it a long time ago. So 3.5 billion years of evolution for living creatures in this planet, and we still have this situation where we all animals, all complex animals, do go through this cycle of sleep. There's a recognizable cycle of it happens in different fashions, in different forms. It takes kinds of different shapes, but nonetheless, to a single organism, every organism seems to go through that has a brain, seems to go through this, through this phase where you have to sleep. So being so vulnerable for so many hours seems to be the type of thing that evolution would have gotten rid of if it could. So the point that I'm trying to make is that it's so necessary for life that we risk being quite vulnerable to predators for quite an extended period of time in order to get the sleep. So fundamental mechanism that sustains life and is one of the main things that I want you to think about it as one of the pillars of health, one of the fundamental pillars of health. And it sustains brain health, as you might expect, so sleep, we might intuitively think is related to brain health. Yeah, that makes sense. It relates to mind health, which was the mental health piece. Again, obviously, mind health and brain health are very much in the same spectrum. And again, intuitively makes sense, but it also supports body health. And I'll explain how that happens. So let's start with brain health. Two concepts to start off with. Okay, so there's three types of sleep, right? So there's deep REM sleep, deep non-REM sleep, sorry, light non-REM sleep, and then there's REM sleep. Okay, so that's kind of the classification. Some people use sleep tracking devices. I do. I've got this ring that tracks my sleep. I use it because it gives me the right mixture of these, and it tells me exactly which one of which I'm obtaining. And I think that's very important, because it needs to be balanced, right? It needs to be, you need all three kinds of sleep. So deep non-REM sleep is associated with memory consolidation. How does that happen? How does that work? How do we know that? So interestingly, these types of sleep happen at different periods in the night. And interestingly, they happen more or less at the same time for you, depending on something that we're going to talk about later, depending on your chronotype. Chronotype is a big word. We're going to break it down later, but chronotype is an important concept. So what it means is that if you go to bed normally at, say, 10 p.m., let's say, as an example, you go to bed normally at 10 p.m., the first 4 hours of your sleep is the biggest opportunity, is the most likely time when you will obtain deep non-REM sleep. That's that time. And the next 4 hours are going to be the opportunity for REM sleep. Okay, right. How much of each do we have? Normally, it's about an hour and a half, an hour and 45 minutes of deep non-REM sleep, and about a bit longer of REM sleep on average per person. About an hour each is okay, right? And we do need both, and they do seem to support different functions. Interestingly, if you go to bed very late, say your normal time is 10, and now you go to bed at 12, your sleep, your opportunity for obtaining deep sleep has been reduced now by those 2 hours. And then the period when you're more likely to be able to obtain REM sleep kicks in, reducing your opportunity for deep sleep. And this does depend on your daily rhythm, it's called circadian rhythm, and it does depend on your chronotype, and it's quite hard to shift. So if you go to bed very late a particular night, it's very likely that you will be deprived of deep non-REM sleep. And if you wake up too early, the opposite happens. The last 4 hours of the night is when you're most likely to get REM sleep. So if you wake up too early, that's the bit of sleep that is deprived. So if we deprive somebody selectively of deep non-REM sleep, what happens? The memory consolidation doesn't happen. It seems that as we go through the day, we start accumulating memories, and these get stored in a short-term memory storage device, let's call it. And when you go to sleep, through this deep non-REM sleep process, those short-term memories become long-term memories. They get consolidated, they get pruned, they get stored in long-term storage for you to be able to sort of retrieve. So when you're doing any learning, this is what happens. And that's why sometimes after you sleep, you seem to perform better, you seem to remember things better. And when you're studying for an exam, it's very important to obtain that deep non-REM sleep, because that's how your information is going to be consolidated. That's how you're going to do good in your exam or test. Or if you're doing a presentation and you need to memorize a bunch of data, not sleeping before the day of the presentation is not a good idea, because this process may fail. There's also a knock-on effect, because if you don't empty that short-term storage, it seems that then it interferes with your ability to form new memories the following day. So the storage is full, is not being decanted, And then any new information coming at us, we're going to have trouble being able to sort of remember it. It's just not going in. So it's a bit of a double whammy. So not being stored, so it's still in the short-term memory storage, and then it's all full, we're not able to store new memories. REM sleep seems to be correlated with creativity and problem solving. So when we're not obtaining enough REM sleep, our ability to solve problems, our ability to think outside the box, our ability to think creatively seems to be impaired. REM sleep is the time when we're most likely to dream, and is when connections, wide range connections between those things that we've learned get formed and in new and creative ways. So that's why dreams can be so bizarre sometimes, because it's very disparate things being connected in random ways to find patterns and to allow us to sort of think creatively. So that's where you are. And that's the meaning of those two things. I should spell out what REM means. REM is rapid eye movement. And basically during REM sleep, what we see is that the eyes are moving very rapidly. And in fact, while we're dreaming, interestingly, we are conscious, even though we are asleep in this strange mode of consciousness, which is called REM sleep. And that's where dreams occur. And sometimes people get the impression that they're not sleeping enough, particularly during the second half of the night, because they might be dreaming. And because dreaming is a conscious experience, and you might be sort of in that twilight area where you're not sure whether this is a dream or whether you're waking up, and you don't remember. You know, you may have broken sleep, but you may have slept more than you think, particularly during that REM phase, because it is an aware, it's a conscious experience. So sometimes it might be difficult to tell that you're sleeping. That's why some sleep trackers might be helpful. Interestingly, if you obtain less overall sleep, so the majority of sleep is light sleep, light non-REM sleep. That's the majority of sleep. Okay, you get about an hour and a half of deep, and you get an hour and a half, a bit more of REM. Okay, so that's kind of the mixture. So the majority of it is light sleep. Is light sleep important? Yes, very much so. If you don't get enough total sleep, which obviously includes mostly light sleep, you will have concentration problems, you have attention problems, and you're more likely to have an accident. So it's the thing that may even endanger your life. So it's as important as that. So just to bear in mind. We subject ourselves to this very weird experiment that we do every year when we push the clocks forward in the spring. And that deprives people of 1 hour sleep. And we see an increase in road traffic accidents immediately as a result of that. I mean, I think it doesn't help anybody, and it should be stopped. So a question from Derek: how much REM sleep do you need each night? About an hour and a half is enough. Yeah, it's about an hour and a half. Is there an optimal amount? You know, anything over an hour is good, is perfectly reasonable. Less than that is when you may have these problems. But yeah, so less than 6 hours total sleep is where you run into these attention mistakes and problems. If you're chronically deprived of sleep, there's a phenomenon called microsleeps that may happen during waking hours. If you look at an accident that may happen when you have consumed too much alcohol, right? The thing about that is that your reflexes are sluggish and a problem, right? So you have a problem with responding to things in time, okay? But you still respond. So you're slow. But if something is coming at you, you will still respond. You just be sluggish and slow. If you have a microsleep during driving, because you've been chronically deprived of sleep, the microsleep, you don't respond at all. You go into a sleep state, basically, for a very brief period of time. And during that time, you're completely unresponsive. So we know that accidents will be much more serious with a microsleep than they would be if you're intoxicated. So I'm trying to sort of say that it's as serious as that, particularly in chronic deprivation of sleep. Okay, I hope that that's clear how that works. So now we're going to talk about mind health. Okay, so in 6 hours is where the 6 hours total sleep is where the problems start to happen, and then less than 1 hour deep sleep, less than 1 hour REM sleep. Yeah, so that's where the numbers are. So with less than 6 hours, we have increased risk of depression, increased risk of anxiety, and something that we have more and more evidence for, increased risk of dementia. So sleep seems to be able to repair the brain. So it's a time when the brain repairs itself and actually sustaining of brain health in general. And that's why we see that increased risk in dementia. Okay, so it's as important as that. So what are the most common mental health conditions that happen that happen with sleep? Well, actually, we have depression and anxiety. They are the ones that most commonly are induced by sleep problems. And also, interestingly, depression and anxiety are the ones that very commonly can disrupt sleep in different ways. Depression usually deprives us of late sleep. So is early morning waking is the normal phenomenon associated with depression. So people wake up too early, 3 o'clock in the morning, 2 o'clock in the morning, not able to go back to sleep. All right. And in anxiety, we have delayed sleep. So people, because they're worrying, they may have thoughts strolling around in their heads. They take a long time to get to sleep. And then worries may wake them up. So they have also interrupted sleep. That's the typical pattern. Interestingly, as a treatment, if you only address, we have this from experiments that we've done. If you don't do nothing to address the mood conditions themselves, but address the sleep problem by itself, you get recovery. You get recovery in depression, you get recovery in anxiety, and you even get recovery in things like bipolar affective disorder. Bipolar affective disorder is an interesting situation, particularly when you have the manic phase of bipolar affective disorder, when you have an expansive mood. You can be irritable, you can be a bit hostile, but you also may feel very powerful, elated. Particularly in the early phases of a manic phase, you may feel like on top of the world, full of energy. Reduced need for sleep is a typical characteristic that happens during the early phases of bipolar affective disorder, an episode of mania. Interestingly, if you get the person that has this reduced feel for, they don't feel that they need sleep. They don't even, they don't think they need it. They are consumed by their creativity and expansive thoughts and things like that. But if you get them to sleep better, you may resolve the hypomanic crisis and improve the likelihood of recovering from an episode. So it's as important as that. Yeah. So it's a two-way street. So depression can make sleep worse, but sleep can make depression worse. And interestingly, you can break the cycle. If you only address the sleep problem, you can break the cycle and you can improve somebody's mental state. Body health. This is the one that is perhaps less easily understood or less spoken about. So the sleep seems to regulate the presence of various hormones. I'm going to talk about 3 hormones that it seems to regulate. 2 work against one another. One is called leptin and the other one is called ghrelin. Ghrelin increases your appetite and makes it more likely for you to crave sweet things and high calorie things. Okay, that's ghrelin. And leptin is kind of does the opposite. Leptin lets you know when you've eaten enough so that you can stop eating, right? So what happens when you're deprived of sleep? When you're deprived of sleep, you seem to get an increase in ghrelin, so more craving for sweet things, more craving for high calorie things, your appetite is greater, comfort foods in particular, and less leptin. So even when you start eating them, you're less likely to feel full, satiated. All right. So it's a bit of a double whammy for obesity. Yeah. Also, it seems to change. I don't know if people are familiar with this idea, but insulin sensitivity. So you may have heard of pre-diabetes. Pre-diabetes is a situation whereby your body is not paying attention to insulin as much as it should do. So you need a greater dose of insulin to achieve the same results. And what insulin does is basically the level of sugar in your blood, it moves that sugar onto your body cells, right? Keeping the level in a controlled way, keeping the level of sugar in a controlled way in your bloodstream. So it does that. So what happens with sleep deprivation? sleep deprivation, we have a less, so we have an impairment in that system whereby the body is less likely to listen to insulin. So insulin needs to get louder. So you have insulin resistance. So you need more insulin to get the same effects. And that is, that's, as I said, is a pre-diabetic state. And it can lead, obviously, it's the start of the vicious cycle that may lead into developing diabetes later on. How many days of sleep deprivation do you need to get this pre-diabetic state? It seems like only a couple will increase your insulin resistance. 2 really bad days of sleep in a row can get you into this state. In some studies, even less. So all of the obesity, sleep apnea, diabetes are all related, and increased risk of heart disease that I've called there, are all kind of related to one another, and are all to do with this metabolic regulation, ghrelin, leptin, insulin. This is all where it is, craving more food, putting on weight, more like to have sleep apnea. Sleep apnea is a process whereby we stop being able to breathe in our sleep, and that wakes us up. And then we have very broken sleep, which is again a vicious cycle. So worse quality sleep, more likely to become more obese, more likely to have, more likely to be more susceptible to sleep apnea. So it's a bit of a vicious cycle there. Also, we know that stress hormones are increased by lack of sleep, and that results in an increased risk of infection. And also, things like sex drive and fertility in general get switched off in this state of raised stress that the body experiences. So that's the other part that also is affected by sleep. And as I said, you can imagine where the increased risk of heart disease comes from that obesity, that sleep apnea, and that increased risk of diabetes, as you might expect. Okay, hopefully that gave you a good overview of what's going on there. How much sleep should you get? I think we've answered the question, about 7 hours, 8 hours. So the way to think about this is that you should have religiously a 8-hour sleep opportunity. That doesn't mean that you're necessarily going to be asleep all the 8 hours, completely, but you should give yourself, if you want to give you the best chance for health, 8 hours sleep opportunity, time that is exclusively dedicated to sleep and nothing else, and be very strict about that. All right. So how about sleep and the menopause? Yeah, I do a whole session on the menopause, addressing in part that problem. Absolutely, Charlotte is saying that managing to sleep during the menopause is very difficult. Yes, vasomotor symptoms will disrupt sleep specifically, and they are a big problem associated with the menopause. I do a whole session on the menopause, trying to sort of answer that question, Charlotte. Sorry, I don't have the opportunity to address it during this talk, but my other talk on the menopause does go into it in quite a lot of detail about what to do and how it can be so tricky, as you quite rightly say there. Absolutely. What are chronotypes? I told you, I gave you this concept earlier. Chronotypes is, I told you that obviously we are all very vulnerable during sleep to predators. So if you imagine humans 100,000 years ago without, with living in a very basic, very exposed environment to predators, for example, how are we going to solve this problem where we're vulnerable for about 8 hours, really, of our days? Well, we do it by being a gregarious animal. We do it by being an animal that lives in community, in communities of about 150 individuals. And interestingly, we have a distribution of people that early birds, let's call it. They're people in the middle, and then they're evening or night owls. And that's the way we solve it. And I'll tell you a little bit more in a minute. And then we're going to go through what is the best way to get a good night's sleep. So yeah, I gave you the spoiler, 8 hours sleep opportunity. If you get less than 6 consistently, that's when those risks climb. And we've got the chronotypes that I just illustrated, the early bird, the night owl or early lark, and night owl kind of prototypes. So early birds are people that find it very easy to wake up quite early, so even 4 a.m. and that's going to be normal for them. So obviously there's a distribution in the population. So there's very few that do this 4 o'clock, 5 o'clock naturally, but there are some. And then you get greater and greater number towards the middle of the distribution. And then you get the night owls, which are people that wake up late, but also go to bed very late. With this distribution in the population, you're able to more or less cover 24 hours. So if you're thinking about this environment in which you're vulnerable to predators, how did humans solve it? We didn't get rid of sleep. What we got is a group of people that could watch out for one another. Is it the same as the late sleep phase? I think that's a term that may be used to express this. Potentially, I'm not sure where you've heard that term, Lucas. But yeah, so basically this is the distribution. So what is the distribution in the population? The majority tend to be, tend to go early. So it's about 30–40% of the population is there. It's in the early bracket. Then another 30% is in the middle bracket, and then another 30 is in the night owl bracket or so. So they're very common, but they do have this distribution. And of course, if you look at the very tails, there's fewer and fewer people in those tails. So there's a very few extremely early birds, and there's a very few extreme night owls, but they do exist. So if you are an employer, I think you need to take this into account and make sure that you're a bit flexible so people are their most productive, because some people are going to be started to be productive at maybe 10, 11 in the morning. I know I'm one of them. I'm a night owl myself. And the best, most productive time is perhaps 6 o'clock, 7 p.m. That's even 8 in my case. And then you tend to sort of go to bed, maybe 1, 2, 3 a.m. Naturally. And then that's where the early birds start to pick up if you on the other side. But also on the other hand, you may have people that are very early. They would like to come into the office very early, and then be able to leave at 4, because that's when they're slumping, their performance is noticeably declining. And being able to allow that flexibility would be good for their health, because obviously they will get the right sleep that corresponds with their chronotype, but also good for the productivity. So it's worth thinking about if you're a manager, about organizing it in this particular way and having that flexibility built in. I'll say one more thing about chronotypes. They shift through time. So we know that children have a shifted chronotype. Anybody who's a parent knows this. They go to bed very early, so they're kind of, and they rise very early. So they're naturally early birds, much more so than the adult population. So you get a lot of children who are, the majority of children will be quote unquote early birds, right? They go to bed very early, they wake up very early, and they ruin your weekend. The night owls correspond to teenagers. So teenagers shift 2 hours the other way. So when the parents are completely very, nodding off, that's when they're awake and they are meeting each other and whatever. There's various theories about why that might be, but I mean, I'll just tell you, in reality, that's what happens, is that the chronotype shifts. So it becomes early first, and then it becomes late, and then it stabilizes. It goes back to the middle as an adult. The one thing that our education system doesn't take into account is this night owl teenager situation. So it would be good for teenagers to be able to get to school much later, because remember that if you ask a teenager to go to bed at, say, 10, it's the same as asking you to go to bed at, say, 7 or 8 p.m. You may want to go to bed at 8 p.m., but you're not going to sleep. It's just not going to happen. So their chronotype is shifted. They are going to stay up late because their chronotype is shifted. And then they cannot really substitute, say you have to wake up at 7 in the morning because you have to get to school. There's going to be sleep deprived. So that's the reality, and it's a tragedy, but is the way we organize things, and maybe we should be a little bit more friendly to teenager sleep. I know I let my teenagers sleep on weekends because I know this fact, and I don't, shout at them for not waking up at the same time I'm pottering about. So how are we going to get a good night's sleep, right? So here's what we're here for, and I've got all the things in order of how successful and how effective they are, omitting nothing. So it's important for you to know that I'm omitting nothing, because medication is not the first one at all, as you can see, right? These are things, these are sleep hygiene techniques. I'm not talking about treating insomnia. That's a different proposition. I will talk a little bit about it, but what we're doing is, how do we give ourselves the best chance to get a good night's sleep, right? So the first, most important, most well-evidenced way in which we can do this is routine. So we are always very fixed on waking up at the same time. We have a job, we have to go to our job, we set up our alarm clock, it has to happen, right? Yeah, I do a whole session on shift workers, Kevin. Yeah, there are complications there. Yeah. Yes, Amanda, thank you very much. If you put them in the Q&A, I should be able to sort of see them at the end. Thank you. Go to bed at the same time. Very much more important than it seems. If you stick to a bedtime, your body will adapt, get ready for sleep, have your best chance of initiating sleep. And if you are very zealous with that 8-hour sleep opportunity, this is the thing that gives you the best chance. So you set an alarm for waking up. You should be as strict as, for your bedtime. Very, very much so. We intuitively know this about our children, and we have a strict bedtime for them. But we don't do that for ourselves as adults when we should. It is actually one of the most important things that you can do to ensure a good night's sleep. The wind down routine, very, very important. Very, very important, the wind down routine. So it may be having having a warm drink, having maybe reading, listening to some music, whatever is part of that routine. In some cases, it's a bit of exercise. It might just be doing things in a prescribed way, always in the same order. For example, you're going to sort of read a bit of a book to wind down, then you're going to have a warm drink, or you're going to have your drink with your book. Then you're going to get ready, get your clothes on, or whatever it is. And some of the other advice that I'm going to give you may incorporate into that bedtime routine. And then you're going to brush your teeth or whatever it is that you do. So it needs to be kind of always the same for it to work the best. And be a little bit ritualized, as it were. And it should take about maybe half an hour to an hour. And then you stick to it. Then you stick to your bedtime, and you stick to your bedtime routine. And you know when to start your bedtime routine, which is maybe an hour before you're planning to go to bed, to give yourself that 8-hour sleep opportunity. This is the single most effective thing that one can do to get to sleep. Somebody was asking about shift work. You can not do the strict bedtime with shift work, obviously, but you can do the routine, and that helps. That helps in itself. Having that bedtime routine can signal to your brain that it is now time to go to bed. You can do other things that we're going to talk about later in shift work as well that may help. Obviously, the one thing that you cannot do is having the strict bedtime. So temperature is actually more important than other things that we might think are important. Is one of the big signals that the body has to know when it's time to sleep. So 18 to 20 degrees is the best. It's best if it feels a bit chilly. Why is that? Because if you think about what we were doing when we were, outside of our comfort homes with our heating on, maybe 100,000 years ago, the sun is up during the day, and as the sun goes down, temperature goes down. That's a big signal that it's nighttime, time for humans to go to sleep. We are diurnal animals. That's where the signal comes, and that's why it's like that. So is the strongest trigger for sleep, experimentally, even more than darkness, interestingly. How can you control body temperature? Interestingly, if you have a warm bath or a warm shower, you can drop the temperature. That is a bit counterintuitive. How can we drop our core temperature? The reason is because you're going in the warm shower, the warm bath. That's elevating your core temperature a little bit, all right? But it's also activating the mechanisms that you have in your body to lose heat, right? In your hands, your body, your face, all the small little vessels open up, you're losing heat, all right? So when you come out of the bath and dress in your comfortable bedclothes, you're dropping that temperature because all the capillaries are open, all the temperature shedding mechanisms have been activated, and you're also dropping from a higher level because you were in the warm bath. So that signal, that dropping in the temperature is what signals is time to go to bed. And that's why maybe having a warm shower as part of your bedtime routine might be very helpful. You need to sort of keep the temperature more or less controlled if you can throughout the night, and make sure that it doesn't, don't put the heating on like hours before you plan to wake up, because that rise in the room temperature might wake you up. So that's the thing to know. Light obviously is a big signal. It needs to be dark. Light controls a hormone called melatonin. Melatonin is also controlled by temperature. So it's light and temperature that control melatonin. You've probably heard of melatonin. It's a hormone that the body secretes naturally when it's deprived of light, and it signals a sleep onset. And that's the one that can be used successfully in shift workers. And people were asking about changing your chronotype. You can do things like that. It's only, in the UK, melatonin is licensed for shift workers. So you could have a consultation with your GP about that and about where melatonin might be a good idea to be able to sort of change the signals around and change your bedtime as you require it. So light needs to be dark. The curtains, eye mask might be something that you might want to do. Artificial light, dimmers and filters are a good idea because blue light is the thing that suppresses this secretion of melatonin the most. And devices, even those with night mode, can shed a ton of light that can wake you up. So if you're having trouble sleeping, you should ban the devices from the bedroom completely. You should not have them there. Charge them somewhere else because they're very distracting. If you wake up in the middle of the night, you're going to be tempted to grab them. That's not a good idea. Because you're going to be, apart from whatever is going on in the device, in social media, whatever, you're also going to get a ton of light in your eyes, which is going to suppress that melatonin and is going to signal that it's time to wake up. So just think about it. Noise, obviously, needs to be quiet. Okay, so some of these things also, just to briefly mention it, because somebody asked about shift work. You can manipulate light and you can use eye masks and things like that to ensure that your environment is very dark and have blackout curtains. This will help in shift work. And noise reduction will also help. So if you use earplugs, and they're very comfortable earplugs now, like modern earplugs can be, you might have to shop around and find the right type for you, but there should be one that suits you quite well and that is comfortable to use. And it's just about getting used. And sometimes having the routine of putting these sleep aids on, dimming the lights, getting the devices out of the bedroom, using your mask, putting your earplugs in, are part of that bedtime routine that signals to your brain it's time to go to bed. So isolated from noises, soft music can be okay. Some people don't have a choice but to process music, and that wakes them up. Some people don't. Some people find it that they can, leave it in the background and it doesn't attract their attention. In those cases, it's fine. Vocals seem to be a problem, interfere with sleep, singable vocals in particular. Tinnitus is hard, Tony. Yeah, I totally agree. That's a problem in itself. Some people find those single vocals too engaging, so it's not for everybody. The rain, white noise like that, like Kim is discussing, can be a good solution, and that can be helpful. And obviously earplugs, as I said before, just consider them. Exercise. We used to say that we shouldn't exercise a bit later, later in the day, because that might wake us up. More recent research reveals that that's not true, that exercise is really good. So you can exercise You might want more gentle exercises as part of your bedtime routine, but not necessarily. The research doesn't support that. In fact, if you increase your temperature and you have your warm shower, we're going to get that good temperature drop effect that may be very helpful. So there is that. Yeah, as I've got there, unlikely, you know, if you're doing yoga with soothing music rather than very high intensity exercise with, you know, loud pump up music, you might avoid some complaints from your neighbors. So that's, you know, what you might consider yoga. But yeah, interestingly, sleep also increases your capacity for exercise, and sleep decreases, you know, that's how decreases. That's another way in which sleep makes it easier for you to lose weight and not have obesity, because it increases your capacity and your appetite for exercise, interestingly. So they benefit one another. Exercise improves sleep, sleep improves exercise. Caffeine, you know what I'm going to say. It actually is very long-lived, and even people that are resistant to caffeine, you know, so it stays for a long time in your body, more than you think. And even people who feel that they're resistant to caffeine and they say, well, I've never had any problem sleeping. I was one of those people until I used my sleep tracker, and I discovered that it was reducing my total sleep was normal, was fine, but my deep sleep was affected by the caffeine. I had very short deep sleep, and I stopped caffeine. I stopped having caffeine, particularly after 12, after midday, and that restored my deep sleep. So it can affect you even if you don't think it's affecting you. So what is the last time you should be thinking of? I think, to be safe, as I said, midday is the safest time to stop. It can be painkillers, it can be covert, so just check that. The one thing that I would say is there's another, so I told you about melatonin being something that increases the levels of melatonin increase as lights goes down and temperature drops, right? And that's a signal for sleep. The other signal for sleep that we have is called adenosine, and that is the more time you've been awake, the more of it is circulating in your brain. And what caffeine does is blocks that signal. So basically, it tells your brain you haven't been awake for that long. It's okay, right? But it doesn't get rid of the adenosine. It just is circulating there in your brain. So what happens is that is blocking it, so your brain doesn't hear it. So basically, you have trouble sleeping, and then you sleep, and then it's time to wake up. Your alarm goes off, and even though sleep has gotten rid of some of that adenosine during sleep, it's still hanging around a little bit of it the following day. So you feel a bit sleepy in the morning, so you tend to go back to caffeine. This vicious cycle ends up in that level of adenosine rising and rising and rising, never quite being cleared, and you feel always in a fog, and you feel always that you need more caffeine to stay awake. So it's a vicious cycle that you would want to stop. So yeah. 11-hour half-life, yeah, that's more or less correct, yeah. 8 hours, so it does depend. So David says 8 hours. Yeah, so half-life is how much time it takes your body to reduce in half. There's fast metabolizers and slow metabolizers. That's what they arrange. So it depends on your personal characteristics. But if you take that 12 o'clock cutoff time, that's safe for most people, even slow metabolizers. Alcohol, it can be tempting because people, I don't know what happened to my number one. Oh, there we go. It doesn't help. It's kind of the summary of it, even though you feel it might help, but it doesn't. It may sedate, you may feel it sedates, but it gives you a very poor quality sleep, and it suppresses, it changes the architecture of sleep. I told you that there has to be this balance between deep sleep, REM sleep, it changes that. What about daytime nap? I'm going to go into that in a minute. Ildiko, I'm going to talk about daytime naps. But I was going to say, don't feel tempted. People ask me about a nightcap, and I tend to say, maybe, because in some cases people find it's helpful for the bedtime routine, and who am I to sort of disrupt that? It will affect sleep. You know, there's no safe dose of alcohol, unfortunately. But it might be that you get more benefits from incorporating that into your bedtime routine because you find it generally soothing. What might just that? Yeah. Oh, sorry. Smoking is a stimulant, so we should avoid it. People sort of worry about cravings. Seems that it doesn't really. I mean, if you're able to sort of not do it, it seems that your quality of sleep is better. If you give in to the craving and smoke, your quality of sleep, even though you might feel it's not worse, it is worse. And it does sort of affect that sleep architecture that I've been talking about from the beginning. And other effects, your airways are affected, are irritated by smoke, and that can lead to low oxygen saturation, and it interacts negatively with sleep apnea, aggravating the problem. Oops. Sleep habits. So people were asking about naps. Naps, if you don't have trouble sleeping, humans naturally have a biphasic sleep. So we have a big sleep in the night and a little sleep in the day. That's natural to most humans. That's okay. If you don't have any trouble sleeping, that's okay. And you can do a daytime nap, that's okay. You're going alongside what human beings normally would do if we didn't have the routines that we have. But if you do have problems sleeping, you shouldn't nap, because you want to increase, every time you have a nap, that adenosine thing that I was talking about is reduced, the brain gets rid of it. You want that maximum signal for the big sleep at night. So that's why you shouldn't nap if you have trouble sleeping. If you are awake, get up from your bed. So you leave the bedroom. One good idea is to restart that bedtime routine that you've set up. So you leave the bedroom and you recommence the bedtime routine. That can be very helpful, and that puts your mind off the thing and gets you going into a direction that is signaling to your brain it's time to sleep again. And it's very clear from research that if you use the bedroom to work and other things, you can make it harder for the brain to link bedroom with sleep. So sleeping or sex, perfectly safe. Other activities, not so safe in terms of preserving your sleep. Meals, late meals tend to be a problem. They give you an insulin peak, and that can disrupt sleep in itself. So a heavy meal might interfere with sleep. As I've got there. If you're going to have a meal, make it light and make it earlier. And remember what I told you at the beginning about ghrelin and leptin that sleep regulates appetite. So if you are eating late and you're upsetting your sleep cycle, then you might eat more, and then you might want to eat later, and you crave, and then it's a vicious cycle that may be setting up. And the last one is about managing stress. There's a thing that you can do, which is worry time, in which you commit yourself to only have your worries and problem solving at a particular time during the day. So if you get a worry, if something pops into your head during the day, you say, no, that's okay. I'm going to save it for my worry time. And if during the worry time, what you do is you go through them, you try to prioritize them. You're going to decide what are you going to do, address them. Are they important enough? Do you still remember them? Maybe they've gone. So you're going to sort of look at things that are important and look at things that are truly urgent and important, and the rest you're going to sort of leave off. If something pops into your head in the middle of the night, you know that in the next day you'll have this time. So you say, either it's a worry that you've already spent some time thinking about during your worry time, so it's solved, so you can remind yourself that you've done that, or you can say, okay, I'm going to save it for the next worry time, so that you deal with it. So it's a way to sort of have a time, and it shouldn't be connected to bedtime. So it should be, after work, mid-evening, I would say, well before bed. And that's the time when you're going to sort of employ this technique about scheduling things, solving things, or delaying things if they can be delayed. And we have a range of techniques that you can learn in the Thrive app. They're all relaxation techniques, and they all help improve sleep, and they all help if your sleeplessness, you have this early part of the night difficulty getting to sleep, so the late onset of sleep. This can be particularly helpful, and they can be part of your bedtime routine. You can incorporate them as part of your bedtime routine. So there we are. How do we seek help? If sleep is affecting your function, we know how it can affect our function. We saw that earlier in the presentation. If sleep is causing distress, if you're feeling distressed, if your duration of sleep has been going on for days, weeks, definitely. Remember, you cannot really catch up on sleep on weekends. That's not true. Unfortunately, you do need to try and be consistent with your sleep as much as you can. If you have other symptoms like mood changes, memory changes, things like that, physical problems, emotional problems. So for example, an example that we were talking about before, menopause is interfering with my sleep. Definite reason to go and seek help. Definite. Where can we seek help? GP is the first port of call. Is the GP going to take it seriously? They should. I told you why it affects all health. If you have no luck, you have to be persistent. There will be GPs that, like me, take an interest in this and that, like me, know about the health consequences of poor sleep. So GP is the first port of call. If you have a difficult to treat problem, yes, there are specialist sleep clinics that the GP can refer you to, right? But the first port of call is going to be the GP, okay? One quick word about sleep remedies. If in insomnia, sometimes under very particular circumstances, they can be used under specialist supervision, I would say. Most of the time, all of the sleep remedies that we have, all of the sleep tablets that we have today affect sleep architecture in negative ways. So it can get us over a hump if we're trying to get to somewhere as part of a treatment plan. I prescribe them and I do this in a limited way and with a clear objective. They're not for chronic use because they will disrupt. So you might be getting subjectively enough sleep, but you're not getting enough non-REM sleep, for example. REM sleep is the one that tends to be suppressed. So enough REM sleep. So you actually are maybe sleeping enough hours, but you're not getting the right kind of sleep because they all affect sleep architecture. So that's important to know. As I said, the best number one treatment, I didn't say this, but I'm going to say it now. The number one treatment for insomnia is cognitive behavioral therapy. That's the one most successful, safest, most effective treatment for insomnia. And obviously we have that technique in the Thrive app, and our therapists can assist you with that if sleep is the biggest problem. The least presenting problem. And of course, if you have depression and anxiety, they will also be able to help with that. So thanks very much. I think, is too much sleep bad? Yeah, I'll answer that question. So it used to be thought yes, and the reason the reason it used to be thought yes is because if you look at health outcomes for people that sleep 9 hours or more, they seem bad. If you dig into the data, what you discover is that these people have a health problem already, and sleep is trying to compensate for it. So no, sleeping too much is not bad. If you're sleeping longer than expected, it's because you may have a physical health problem and your body is using its natural repair mechanisms to take care of it. So it's the other way around, is your sleep is a response to the physical health problem that you may be having. And that's why it's important to understand the relationship between sleep and body health, because it may be something that is happening. So if you're too sedated all the time, it's also worth consulting, not because you're worried about having too much sleep, but because of what your body's trying to do. It's trying to repair itself in some kind of way. And that's why the sleep is so, you're sleeping so much, you're sleeping perhaps excessively. So I think hopefully that's clear. We don't have a lot of time for questions. Yeah, thank you. No worries. So I'm going to sort of take a couple. Is REM sleep restful? Yes, it is actually. In fact, it may subjectively not feel restful, but it is. It is part of your rest, and because you are conscious during that experience, some people feel it's interfering with the sleep, or it's not good quality sleep. It is good quality sleep, and you do need it, even though it might, subjectively not feel like that. Do you have any tips for people who are neurodiverse? Okay, so in children who are neurodiverse, that's a very specialist area, and yes, there might be some specific things that might be done, but it would be with the support of that specialist that knows your specific case. So I wouldn't be able to give you generic advice other than please do seek help, and there are things that can be done for sure, but it will be under specialist supervision. I try to have a good night's sleep every day. However, it has got a big impact. If once a week, I sleep 5 hours due to other commitments. So obviously you want to minimize the time when you're short sleeping. If you have no chance, then you have no chance. If you have, this is Lorena is asking this question. If you have no opportunity, then you have no opportunity. What can you do? But you would try to rearrange things so that you're able to sleep, give you that 8-hour sleep opportunity. If you do value your health, I think it might be a good reason to prioritize that. So try to do that. I think it's now 1 o'clock and people are clicking off. So I think we're going to stop there. The recording is available, and also some people were asking about the slides, which we will make available to attendees, I'm sure. If you registered, you should be able to get a copy of my slides as well. So I hope you enjoyed it. I hope that was useful, and I hope you take 1 or 2 tips that you can action today. So hopefully you'll be sleeping a lot better thanks to some of that. Thank you.